Today we will discuss about health tourism in Turkey, and we will try to answer the question why Turkey is one of the top main destinations about health tourism. I will share my screen with you because I have an overview introduction about tonight. Yes, health tourism online webinar today, and our guest I mentioned Ertan Erel, consultant plastic reconstructive surgeon. Özge Öztürk, she has a PhD, Prosthodontics dental area, and Kemal Sidar, CEO and UK business advisor. Why Turkey is the #1 health tourism destination? I tried to research a bit more about this content, and I find out why they say that Turkey has a strong hand about this sector. So because there are many hospitals qualified, certified for the international authorizations. So experienced surgeons, thermal places, hospitality, and transfer flights hub, as Istanbul has a flights hub, and also low prices. So in 2017, Turkey's Ministry of Health announced the new health tourism regulation in Turkey. International Health Tourism and Tourist Health Regulation was published in official newspaper number on 13 July 2017, which is quite new. It's about 3 years already since start. So the rules cover healthcare standards and authorization and pricing. So health institutions and tourism medical agencies must obtain an international health tourism authorization certificate to continue to offer health tourism services. So this certificate, government and the government health tourism board authority gives to the applicant. So applicant must have this certificate to serve international patients. So this certificate called International Health Tourism Authorization Certificate. So the list of the number who got this certificate, you can read this QR code. Or you can type this International Health Tourism Authorization Certificate in Turkey, you will find out the website related to this. If you see any clinic, hospital, and doctor on their website has this certificate, which means they have to have certain rules based on the government regulation to provide the services to you as an international patient. So this is not the Bitcoin or some other coins. This is the Joint Communication National Quality Approval Gold Seal by JCI. JCI, the Joint Commission International, is an independent non-profit organization, accredits and certifies healthcare organizations program across the globe. So if you see this certificate on any hospital, that's mean they are the golden certificate serving international quality. The quality of care and the patient safety are very important for JCI accredited healthcare organizations. As I checked, there are more than 1,000 healthcare organizations have achieved this gold seal of approval as JCI accredited organization. So again, if you try to find out who are these hospitals, so you can check this link or read the QR code. So that's very short introduction that I tried to point out the two main certificate, one in Turkey and one international. So better for you to understand, if you search any clinic in Turkey, you can check their website if they have these two certificates. So I'm gonna come back to you. And we can start with Özge Öztürk, because she's based in Turkey 2 hours ahead from our time. Hi, Özge.
Hi, everyone. Good evening.
Hi, good evening. Yes, I was trying to ask you to share your screen, but before that, we can say who is Özge Öztürk.
I'm Dr. Özge Öztürk. I am specialized in prosthodontics in dentistry, and I am working in Aydinlar Dental Group and as a clinical chief. And Aydinlar Dental Group is in collaboration with Acıbadem Healthcare Group. And for tonight, we were asked to pick 2 questions to discuss, and I chose the first 2 questions: why Turkey is the main destination for health tourism. I would like to start my speech talking about Turkey a little bit. As we know, Turkey is located between 2 continents and stands as a bridge and links Europe to Asia and Middle East. For centuries, Anatolia was used as an express passage for trading from both going west to east and east to west, and that made Anatolia a center of attention for many civilizations. And Anatolia had been witness to many invasions. That's why Turkey is very rich in history. Our country hosts the most archaeological sites in the world. We have the biggest open air museums from Cappadocia to Ephesus. We have 10,000 years old Göbekli Tepe, which is known to be the oldest temple in the world. And we have Hatay Museum, which exhibits the ancient Roman and Byzantine mosaics. Anatolian Peninsula is surrounded by 3 seas, and this geographic location offers a wonderful advantage for tourism. Turkey is the 6th most visited tourism destination in the world, according to the World Tourism Organization. Besides this geopolitical importance, Turkey is the rapidly developing country with a high number of very well educated young population and becoming the world's one of the best in the field of medical services. As a result, giving high quality health and tourism services at the same time makes Turkey #1 candidate for health tourism. There are elements that empower a country's health tourism. I want to speak about them and try to summarize them. Quality of health services is our main topic. Turkey's medical services meet the highest international standards, and its healthcare professionals attain the highest qualifications. It is a state policy to provide quality healthcare services both in public and private hospitals. Our citizens can get advanced levels of medical and dental treatments in our country. Together with the tourism potential, Turkey has moved further. There are more than 100 medicine schools and more than 90 dental faculties in Turkey. Many of the doctors go abroad to join fellowship programs after their graduation. They can easily get scholarship from the government, and they are specialized in specific branches. For example, one of my surgeon colleagues, he went to England 25 years ago to get further education in organ transplantation. The same doctor went to United States 12 years ago to learn obesity surgery, and he is the first one to start obesity surgery in Turkey, and he raised many academic staff in his university. According to the Joint Commission International website, Turkey has 30 accredited hospitals, and 4 of these hospitals belong to the group I am working for. We have many private hospitals designed specially like 5-star hotel in Turkey. Acıbadem Health Group has 21 hospitals, each with a different concept and design. For example, in my location, Acıbadem Fulya, in the lobby, we have a pianist that playing a piano at certain hours. Another location has a different design and concept, and a harp is being played at lunch breaks. And our hospitals are very well equipped and they have the latest technology. And this has led Turkey to become a rising star for health tourism. During COVID pandemic, even we have the highest numbers of COVID patients, we are able to find a ventilator or an intensive care unit easily. The death rates are comparatively low. There has never been a crisis, and it shows our hospital capacity and quality of medical services. Another issue is the quality of tourism services. Turkey has always been popular with its historical places and turquoise Mediterranean coasts. Many tourists are attracted to its ancient history and natural wonders and nice climates and traditional food, etc. You can enjoy a 5-star luxury hotel in Turkey, have a sea and sun holiday, or join a blue voyage, or go in historical sightseeing. At the same time, you can go to a skiing center. You can book any kind of holiday for any budget, yet you will have a great experience in our country. The staff working in tourism sector is well trained and most of them can speak English fluently. So many years of experience in tourism sector, in facilities and workforce has been a subsidiary advantage for health tourism as well. Another factor is the affordable prices. When you come to Turkey, you can have medical treatments with higher quality, but you will pay less. It is approximately 40–50% less than United Kingdom and United States. Of course, it's changing according to the treatment type. You can have treatment, the medical treatments and holiday at the same time for the same price that you are going to pay for your medical treatment in your country. In my branch, in dental treatments, the cost is 40% cheaper than the European Union countries, most of them. The low price is due to the low costs of the qualified workforce compared to the European Union countries and United States. Another factor is the support of the state. You mentioned when you start your speech, Turkish Republic has a policy to support health tourism. Actually, it's a long discussion subject, but I will summarize a little bit. Healthcare facilities and medical travel agencies who are accredited for health tourism authorization certificate by the Ministry of Health can get a refund from the Ministry of Treasury and Finance for their health tourism investments, including their advertisement actions, their marketing actions, or for their contact offices abroad, up to 70% they spend. The list of incentives is too long, and these procedures are followed by our international patient departments. And one of the other factor is Turkish hospitality. Actually, it's an emotional subject, but Turkish people are known for their hospitality. In tourism services and medical services, this feature is happily appreciated. If you're having a medical treatment in Turkey, Turkish hospitality makes you feel at home and safe. Sometimes our dental treatment patients are coming to Turkey on their own without any companion, and they never feel alone. To be honest, sometimes we make closer relations with our foreign patients than our Turkish patients. Maybe we consider them our guests from another country. We want them to be fully satisfied in all services, and we don't want any complication when they are back to their country. And many of my patients came back to Turkey with their friends and family, even they finished their treatments in Turkey, just to explore more and join Turkey. So all of these features mentioned make Turkey one of the ideal health tourism attractions in the region. Our patients arrive as patients but leave as friends and family. I have been many times invited by my foreign patients to their country and their house. Once I accepted one of the invitations. He was a famous member of a family from Switzerland, and he has a huge mansion in the border of Switzerland and the city of Constance. He gave a classical music concert. Me and my dental surgeon were his guests, and he announced us to the crowd, his friends from Turkey. And this makes our job very enjoyable, and we have many good memories with our foreign patients. As I mentioned before, our geographical location offers a lot of holiday options for everyone. We have a country who has living 4 seasons, and you have very different options for vacation. For tonight, the second question was, what are the advantages for the patients who came to Turkey? We have a high quality of treatments in Turkey for dental services as well. We have patients traveling for quality rather than price. Of course, the price is very affordable. Our dental technicians are very well equipped, and they are very skilled technicians. The dentists are all expertise in specific branches. We have computer-aided design and manufacturing systems in our clinic, and that enables us to produce porcelain crowns in only one visit, and that saves a lot of time. Even a COVID pandemic, we had patients from Switzerland and Germany to continue their treatments in Istanbul. We were working under very strict precautions, and we sent them back to their country, finished their treatments. Our follow-up services are very good in Turkey. We are always in touch with our patients. We have international patient departments that patients can easily access them via email or WhatsApp or by telephone. We make online consultations, and we have dental clinics abroad we cooperated with for imaging, pre-op X-rays, and for post-op checkup services. As I mentioned before, we have affordable prices for higher quality treatments, which are costing less than 40–30%. Last month, I had a patient from Berlin. She said that she was unable to get an appointment from her dentist. They postponed her a few months, and in an even urgent situation, maybe the COVID pandemic made it difficult for them. I heard the similar complaint from English patients as well. You can easily get appointments from Turkey quickly. Our staff is very well trained, and they speak English, and we can find and arrange a translator easily for any language. We have VIP services. We pick our patients from airport to their hotels, and their hotels from their hotels to our hospital with VIP shuttles. For dental treatment patients who had general anesthesia, we hospitalized them in our 5-star hotel like patient room, and they are under good care and under good comfortable conditions. We have visa advantage. More than 70 countries have visa-free access to Turkey, and some of them can easily apply from internet to have visa for Turkey. And Turkish Airlines is a big advantage. It has many direct flights and flies over 100 countries. And our patients can combine their treatment, dental treatments and holiday together. For example, some patients of mine started their treatment in Istanbul and they go Antalya, and when they finish their vacation, they return back to Istanbul and we finish their dental treatments. Here are some pictures taken in our clinic with our foreign patients, with smiling patients. We made very close friends with them. Ones who have dental treatments in Istanbul tries to come to Turkey second time with their families and friends. When they come back again, they come for us for checkups, and it's very nice to see them again and see them very satisfied and happy with their treatments. Thank you for listening to me. My speech is over.
Thank you so much, Özge. It was very nice and a warm presentation about Turkey, which I miss very much. It's almost 1 year I haven't been there, so it was great to see some pictures. Thank you. And I just have a question. Aydinlar Dental
Yes.
is belong to the Acıbadem group, or is it independent brand?
Actually, it's both independent but also connected to Acıbadem Health Group. Aydinlar Dental has many clinics belonging to or working under Acıbadem Health Group. Most of the Acıbadem hospitals have Aydinlar Dental clinics in their own area.
Okay. You mentioned that you are serving in GCI accredited certificate.
Yes, I was 10 years ago. JCI commission came to our hospital for auditing. Yeah, it was a they are very careful. Even in dental clinic, they asked many questions. They examined everything, but everything was perfect. And Acıbadem group pays attention to GCI too much. And I am lucky and honored to working to part of this hospital group and Aydinlar Dental.
Okay, if you finish your screen share, we can just stop it.
Yes.
Great, thank you so much. Would you like to add anything else apart of your presentation?
If they have any questions, I'm continuing listening to everyone. Afterwards, they can ask their questions, and I can easily and gladly answer their questions.
Okay, great. So I was communicating with the Foreign Economic Relations Board of Turkey, which is DEIK. And I spoke with Ms. Basak Jambulak, and she shared with me some of the very important recent statistics. So I would like to show you for great numbers that why Turkey is one of the great destinations. So can you see this letter reading? This. Can you see it? Yeah. So the medical tourism and Turkey's rule, they have a very good report. If anyone would like to have this one, I can share it. So they say in 2019, Turkey had 650,000 international patients. And so health tourism started last 15 years, and it's developing in a positive way year by year. So Turkey attracts the patient mainly from these certain countries: Azerbaijan, Iraq, Bulgaria, Georgia, Syria, Middle East and Gulf region countries, the Kuwait, Qatar, Bahrain, United Arab Emirates, the Oman, Lebanon, Jordan, and also African countries, the Balkan countries, and of course the European countries. So they mentioned the major strengths and advantages of Turkish private health care sector. And they say it's state-of-the-art technology and infrastructure and top quality services, as Dr. Özge mentioned about the quality services, the hospitality services in Turkey. 33 hospitals belong to the JCI board. They have this amazing gold certificate. So easy access to medical services, geographical location, and easy transportation. So as Turkish Airlines almost fly to everywhere, so it's easy to connect Turkey. Also between UK and Turkey, it's about 3.5 hours. So it's very convenient to fly to Turkey for the health reasons. A leading tourism destination. So they say in 2019, over 50 million tourists visited Turkey. And they also has some report about the pharma and who produced this report. Oh, these are the council members, health council members belong to the DIK. So this report has been present by Resat Bahat and Basak Jamplat. Thank you so much for sharing this. If anyone would like to get this report, I'm happy to send by email. Please type your email address on the chat box. I can share with you. And also there is a pool link under the screen. Please answer this important question for us. And if you have any question during the webinar, you can type it in the Q&A box. So now my other guest, who is the UK business advisor and CEO of the London Bridge project, Kemal Sidar. Hi, Kemal.
Hello, Arzu. How are you? Good to see you.
Hi. Thanks for accepting our webinar. It was a bit kind of last-minute invitation, but thank you so much. I know you have a busy schedule, but it was very kind. So you are going to explain the strategies, healthcare sector strategies in UK, and maybe you can compare some of the contents related to Turkey as well. So,
yeah, okay. Stage is mine, I guess. Thank you very much. Hello, everyone. Hello from London. Especially, I am West London, close to Reading area. I'm living in the UK more than 4 years now. Actually, I'm an entrepreneur and investor at the same time, I can say. I'm a little familiar with the Turkish ecosystem, including the healthcare, because we have 5 clinics in Turkey. 4 of them are for focusing the childcare. 1 of them is food clinic. And also I am doing international business located in London, that we are representing a couple of international customers from South Africa, Bulgaria, Spain, US, and some other countries as well. So today I want to really focus on the perception of the UK clients, customers who are looking for any kind of healthcare from international service providers. When we speak about the Turkish healthcare system, I can easily say that we are mainly looking at ourselves. So what it means that we only speak about our strong sides, such as we have that hospitality infrastructure, we have talented guys, doctors, and really well-developed hospitals and other services that we can provide to the international clients. However, from the UK perspective, it is a little different. British people, I can say British, they need to know more about the Turkish market and Turkish healthcare services. We need to more invest on the presentation and marketing our services. So if you want to start anything about the healthcare, it might be like a dental healthcare, plastic surgery, or any other healthcare, or I don't know, selling products that can be complementary with your services, healthcare services. You need to initially do your analysis first. So which part of the country are you going to start focusing on? Because the geography and the demography of the UK is totally different from south to east, north to west. If you speak about the London, that I can say most of the, let's say, rich people are living in London, because it's not easy to live in London, mainly the region one, I can say. This is a different strategy. If you are focusing on Midlands, I can say Birmingham. If you're focusing on the north side, let's say Newcastle, these are different strategies. So initially you need to understand where you're looking at, what your customers are expecting, and who are your benchmarks. So you need to know about who is going to compete with. So to do that, you can run an analysis, or you can do an infrastructure study to understand the client expectations. As we are represented a couple of healthcare services in Turkey, we done it a lot in a couple of years. So we usually saw that they are relying on references. So the first thing you need to do is you need to create references that can promote your healthcare services as fast as possible. That may include like combined service packages such as tourism, or integrated services like selling cosmetics or giving some cosmetics, bundling it. So it really helps you to penetrate the UK market. Without understanding the UK expectations, it's not easy to do. It's not easy to introduce your services directly, because people are, I can say honestly, frightened about the international service providers. They rely on the references. They rely on their friends. They want to understand who their friends are going. And second stage, unfortunately, I experienced that most of the time, the creme de la creme patients are going to Western European countries. So it's not very easy to penetrate that market directly without having a touch base in the UK. You need to create a touch base in the UK, which means that, of course, I understand that it's not easy. You can give clinical advices in the UK without have that kind of legislations or documentation. What you need to do is you may agree with third-party suppliers that they can represent you in the UK. So it gives patients that they are relying and seeing your services locally to understand what you're offering, to see that you are a real person, you have the real infrastructure, you have that kind of experiences, and they can come and see. And probably you can also do some online consultations to understand the customer requirements. For example, we've done it a couple of times for plastic surgeries and also a dental hospital. Whenever you have someone locally in the UK that representing your hospital, your services, representing yourself, it gives more confidence to the potential patient. And thirdly, you may also think about bundling your services, which means that the competition is going high and high recently. So you may offer some kind of bundle products. It really works. That I'm saying that because we also representing and selling cosmetic or medical products in the UK, and the UK patients are caring about the free samples or bundle products rather than the discounts. It is strange because they don't really concern about the payments, as the pound is strong exchange currency, so it's not a problem for them to buy anything. But it's a motivational that they have that kind of medical bundle or medical supplying products that they can continue on their treatment. So it's the third part of the strategy that you need to know. First, you need to understand and know the clients, potential patients, and do the benchmark to understand where you're going to focus on, how you're going to start, where you're going to market your services. And secondly, you need to understand that you need to have a kind of touch base in the UK market to boost or increase your sales, because we experienced it a lot in previous times that people are looking for familiar faces who can speak native British or done that kind of surgeries previously in Turkey especially, and have positive feedbacks to help them more about to understand the Turkish healthcare ecosystem. But I'm saying that if you are a new starter, or if you are looking to penetrate to the UK market, if you are an Aydinlar group, for example, as Özge working at, you have that kind of penetration already. But if you are a small hospital, if you are a group of doctors that are looking for international patient or want to increase your sales internationally, it's an important point. And it's not that much expensive, by the way, because you can also use some incentives to finance your costs in the UK. It is valid internationally. So it's not only specific to the UK market, but as we are speaking about the UK market, it is an opportunity for you to use the Turkish incentives, healthcare incentives, or marketing incentives. I'm going to speak more about it very soon, to increase your sales, to increase your penetration. And thirdly, bundles. So again, I believe that it's a good strategy to include some bundle products into your services, like creams, like cosmetic peelings, medical creams that have necessary um, documentation in the UK market, obviously. So it's not like selling anything in the UK or giving anything in the UK, but you need to comply with the legislation. So these three main strategy brings us success in previous years. Another one is digital marketing. So as I said, the references are very important, but it's not easy to get that references to promote your services, creating a month-to-month marketing strategy. So you need to rely on the digital marketing at the same time. To do that, you need a team who are native in the UK or understand the British sales culture. So I'm not speaking about speaking English. This is different. So you need to understand how the potential patients are acting, what they are looking for. It is a native sales approach to potential UK-based patients. So it's very important to work with companies who are familiar with that. I know a couple of guys in Turkey, digital marketing companies or freelance consultants doing great about marketing healthcare services in the UK, or I can say internationally. You need to create your own content. You need to create your video. I'm sure most of the time the audiences are using Instagram. So Instagram is another tool, but there are some other local interfaces as well. Incentives is another advantage for you. So to boost your sales, it's not only healthcare services, it's also digital marketing incentives.
So you are talking if any healthcare companies produce their products, services in UK, what is the advantages and the strategies for them to help? But if we do the opposite way, if any UK product and services go to Turkey, is not going to be difficult as much as you explained to integrate the UK market. It's very easy in Turkey, but so through producing some products in European Union countries as well as the UK quit recently, but still some regulation carry on. So do you think they have to have certain certificates for the specific products?
Yes, but it's not complicated. It's straightforward process. So we have done it a couple of times in the past. So it's not complicated, but yes, you need to satisfy some kind of documentation to sell or representing. However, most of the time, Turkish producers have that kind of documentation already ready. So it's like a private labeling for your company or hospital. It's really charming. It's really attractive for the UK patients who are looking for international treatment. It really helps us to sell more. with respect to our competitors. We do that benchmarks previously, as well as it's an ongoing income streamline for the healthcare service providers, because you treat your customer once, I can say. However, you can sell your products continuously, and as may your customer will not need any more treatment. However, they will need more cosmetics or medical creams where possible, of course. And it is like a carrot, as we use in Turkish, for the potential clients to come and get treatment in Turkey. And to complete what I was saying about the incentives, digital marketing is also very important strategy to penetrate the UK market. And Turkish Ministry of Trade is also providing huge amount of incentives. It's 75% of your Google AdWords, for example, costs up to $400,000. So it's a huge opportunity to promote your services through the digital marketing interfaces by using the ministry's incentives actively. As a summary, if you want to penetrate to the UK market, initially you need to understand the patient expectations. I'm speaking about the new starters or who are looking to increase their penetration to the UK market. And secondly, I strongly suggest who are looking to sell in the UK to focus areas or focus on typical patient demography, because it really helps you to understand what they are expecting, as well as it really cuts the cost to reach out to people. And also you need references to promote your services, to promote your healthcare services, or you need to create some bundles or actively use digital marketing to directly explain how you get that differences. Because I know, for example, Eastern European companies and Spanish, Italian, and US guys having infrastructures, having hospitals, having clinics in the UK and competing with the Turkish market. Additionally, I can say that if you may remember, a couple years ago, there was a unfortunate event. A lady has passed away in Izmir, I guess, during a surgery. And the media in here strongly used that against the Turkish healthcare system. It's not that much innocent act, as I can say, because it was on purpose. Statistically, although it's unfortunate, it can happen anyone in the world. It may happen in the US, it may happen in Spain, it may happen in Turkey, and it happened in Turkey. However, they used against us strongly. This is why we are gaining a lot of patients in the UK and stealing their market share in the UK and having that patient and treatment in the UK. We are really strong in the UK market, but it's getting more complicated to gain more market share in the market due to the competition, especially for the new starters.
I didn't know this unfortunate news, but you are right. If any small case happened in Turkey, the media used negatively to talking about the health sector in Turkey. But during the pandemic, we saw that Turkey rapidly adopts the new system, the COVID system, quickly than other European countries. Mm-hmm. So the number of the cases were a lot comparing the population, obviously, but also we have quite qualified hospitals. They took action better than UK. So I'm not going to talk about how is the situation now is increasing a lot. Yeah. We are not suggesting anyone to go in Turkey at the moment by the government regulations, obviously, but in the future, when they start to having the tourists to Turkey, the people will take an advantage to go and have a treatment, certain treatments in Turkey, as well as they have in holiday. So we just need to focus what is the news about the COVID situation, recent regulations, but I'm sure, as I mentioned earlier and Özge mentioned, so it is the development sector, health tourism sector. So year by year, the government take really serious actions, and they provide the new regulations to monitor the market. So for the international patient, I don't think it's going to be any issue to go in and have any treatment in Turkey if they research deeply before they take an action and they choose the right clinic, and looking at this certain certificate, as I mentioned in my introduction. So if they have a certificate and the government proof authorized that clinic able to get international patients, I don't think there is going to be any problem. But if the patient chose any clinic without serious research and they just go and have a treatment, it's actually their responsibility to have any kind of result in the end. So it is complicated.
Yes, it is not easy.
Yeah.
However, as you said, that having that kind of certain certifications are a proof of a quality,
Yeah.
as well as that hospitals are also covering everything, starting from the airplanes, I mean transfers, hotels. So it's like a 5-star experience for a potential patient. And I heard a lot of times that they are really happy about it, but the market is huge, and probably we are touching 20% of the potential market.
That's true. Would you like to add anything else? You can have a chance to speak later a little bit more if you want. I can introduce the Ertan.
Yeah,
No? Yeah,
pleasure.
perfect. Thank you very much.
Good evening.
Hi, Ertan Erel, Dr. Ertan Erel. He is based in UK, working, serving for NHS, and also he has a Erel plastic surgery company as a plastic surgeon. Hi, Ertan. We had another webinar earlier in the pandemic with İlay Maden. So you gave us a lot of great information. So I would like to take this opportunity, invite you again and to announce to my guests and also sectoral events followers. As many of you know that I always share webinars, videos on YouTube, so we will be able to share, and some more people will watch later. So Ertan, you are very busy. I know we discussed that every day you have operation these days. Why it's so busy schedule? You have just UK just open, and people want to renewable themselves, or what is the reason?
In UK, patients were locked down for a long period of time, and they sort of, in a way, got fed up, got bored, and they started thinking about themselves. And there's a lot of internet searches for procedures. They also saved up some money because they couldn't go on holidays. So during the lockdown period, government gave them opportunity to stay at home and get paid. So they thought that maybe they can have some time to have plastic surgery and make them feel better in a way. So during this lockdown period, the business seems to be booming, and they also cannot go abroad. So I'm working with 3 different clinics, and they're fully booked. The patients like to have the video consultation in some of them. So there's a lot of shoppers around, and they also like to have the operations. So especially in this Easter period, we've got a lot of demand, much more than the previous sort of period before the lockdown. And it is going to go more and more and more. And this has opened up an opportunity to do the online searches. So reviews, patient reviews are very important. So everybody is trying to get something before the summer and have a nice treatment so that they can go on holidays when the restrictions are lifted.
Yes, and now you say they cannot go abroad. That's why you are getting fully booked appointments. But as you are also from Turkey, they know that you can operate them very reasonable prices in Turkey as well. So you work in both countries, yes?
Yes. Well, I'm mainly based in UK, but I can also work in Turkey because I'm sort of double qualified in both countries.
Which hospital you are mostly work when you operate someone in Turkey?
There are a few hospitals in Izmir. I also have admission rights in Istanbul, Hisar Hospital, but I haven't worked there for a long period of time. It's mainly the Izmir.
Okay, great. So tonight we have some question to you, but before you can explain what qualification you have, you are the plastic surgeon. You studied in UK, right?
Yes, I qualified in Turkey and then came to UK. And first I became a general surgeon and then master's degree and specialized in plastic surgery. So I'm currently working in the NHS as a consultant plastic surgeon, and I also have a private practice in Glasgow, around Manchester, and in London.
That's great, Ertan. So which are the top medical treatments demanded in Turkey? I know the hair transplant is very, very famous in Turkey. Turkey is the #1 destination, especially getting the Eastern countries patients. But from your knowledge, what are the top medical treatments the people choose to go to Turkey from UK?
One of them is rhinoplasty. Istanbul is becoming like a world rhinoplasty center. So Turkish plastic surgeons are well trained in rhinoplasty, and there are lots of conferences held by the Turkish plastic surgeons. So that attracts people. Apart from that, breast surgery, breast augmentation, breast reduction, abdominoplasty, and as earlier on mentioned, on like a Brazilian butt lift procedure. So people tend to go for just a body shaping, contouring procedures. Also, dental treatments are in very popular from this side.
Would you like to share anything on the screen, or shall we carry on like
you just carry on talking, I think, because
okay.
There was a lot of sharing beforehand, so
yeah. And some insurance company cover the most famous hospitals in Turkey. So if anyone use their insurance policy, are they allowed to use in Turkey?
I have explored this option many years ago because people from UK, they want to go to Turkey because it's cheaper, and some of them wants to combine it with holiday. But then if there is a problem, could be a few % of patients that might have problem. So what can they do when they come back? Because nobody wants to take ownership of those patients, and they are left in the air, and they can't just go back to Turkey easily. So I inquired about this, and there are some insurance companies that can provide health tourism insurance, but usually the duration of it is like a 1 month period. So it is possible to get insurance, maybe a few £100 extra on top of the surgical fee or package fee that can be combined. So I will strongly advise the Turkish Health Tourism Group to explore this and find insurance companies and have a deal with them. So it is possible.
I think the government, Turkish government, deal with some insurance company between the Balkan countries and Turkey, but I'm not quite sure. They haven't started yet with the UK insurance company to get a special agreement, but we will monitor this, obviously. How patients can research a reliable health tourism clinic or health tourism advisor to get the service, best service?
There are so many health tourism companies in Turkey trying to get into the market. But for people who wants to find the good ones, they need to look at the reviews, feedback from the patients, and if there is any post-operative care plan. Because what I come across with some sort of patients who had complaints or problems, that they either cannot go back to Turkey or they haven't got much sort of help from the company in Turkey with the complications. So I've seen a few patients and tried to help them because I'm Turkish. So there should be some more, better way of following up the patients and trying to give them, solutions. Maybe video calls are just becoming more popular now, and trying to give them more reassurance and help in this aspect.
So with your patient, what you do with the pre and the post-treatment stages? So how you follow up with your patients if they would like to get the treatment in Turkey with your services?
Yes, I can tell you about the English side, because if you know how we operate here, so that you can try to adopt a similar system so the patients are more familiar. Initial consultation is either face-to-face or an online consultation, minimum half an hour, sometimes 45 minutes. And then a patient will be examined and a plan made. Best to see them face-to-face before proceeding with surgery. But the online consultation can also counted as the first consultation, and we need to have 2 weeks cooling period. So after 2 weeks, patient can have the surgery. We don't really like to operate next day because they need to think about it, and there is a lot of information given to them. After the surgery, the nurse sees the patient 1 week's time, checks the wound, and if there is any problem, informs the surgeon. And also the patients, they have a telephone contact with a nurse or a doctor or a clinic, so that they always have a line or helpline. And I usually see the patients after 6 weeks, make sure that they are or healed. If they have any questions, then I answer them. And sometimes I say come back in 6 months. So that's our routine here. I know that in Turkey, once the patient left the country, there's not much follow-up. So this was highlighted in our plastic surgery conference many years ago, the weaknesses of health tourism. And I still see that the weakness carries on for some patients. So pre-op consultation, patient selection, and follow-up care. So these are very important things to have a very sustainable health service. And if you are competing with other countries, you need to be on top of that. So that's what I can say at the moment.
I think on that stage, for Turkey clinics in Turkey, good to have some collaboration from their field to have other clinic collaboration in other countries. If the patient come from their country, and they can have a first treatment for the follow-up when they go back to their country, and these clinics, the partner clinics, can follow up their patients. So I am not sure the regulation on this side, but I think government with the new regulation since 2017, and they allow the clinics and the healthcare services to go to other countries abroad to set up an office and to do marketings and to inform the patients in their foreign countries. I think this means that they can also collaborate with other clinics as a partnership kind of to have their patients follow-up treatments after they left Turkey. So I hope in this stage that many big clinics can have this opportunity if the regulation allow them to do it. It could be very convenient for us as well. For example, I'm going to have dental treatment in Turkey, and after 1 month, if something happens, shall I just take a flight to go to Turkey again? Or if it's impossible, then maybe it's good for me to have another follow-up treatment if they have a collaboration partnership here in any dental clinic here. So obviously the prices will make sense in that stage, but I'm not sure how they will serve this. What do you think about it? Do you collaborate with any clinics from Turkey? They ask you to help them, work with them?
Yes, I have seen quite a number of patients who had some complaints and they couldn't go to Turkey for lockdown or whatever reason. But this is usually just the individual basis. Somehow they sort of reach me, or I know the surgeon in Turkey. So I'm happy to help out if there is any problem. I mean, it happened in my hospital as well. That one of my nurses' daughter-in-law had a tummy tuck operation, but she ended up having a problem in her abdomen, and I looked after the patient for 2 months, and she was just, my other 2 colleagues didn't even want to touch her, but I did manage to get her healed, and she wrote a nice review on my website. So what I would suggest is that if people are thinking about going into health, so the business, they need to think broad rather than just the patient will come and will take the money. And they need to think about the marketing, as mentioned earlier on, and aftercare as a package, so that there won't be any loopholes for the Turkish market, that people can campaign against it. And I think there was a TV documentary as well about one lady that she sort of complained. So it is an important topic. It can generate a lot of revenue, but people need to be careful rather than just thinking on the day that we're going to get some money from these patients. Not just thinking of the money, just the service needs to be well taught and planned and backup in different countries. If there is a problem, how are we going to sort the problem out? One way is to get an insurance. So have a deal with the insurance company. So if the patient has a problem, then the insurance company can allocate a surgeon or a clinician to see the patient and pay, meet all the payments. So the patient can be sorted out in their own country. And that will be a good move. Alternatively, maybe patients are sort of advised to go back to Turkey. So the contact needs to be well established after the surgery, rather than just forgetting about them once they leave the country.
I think government working on the data system, once they enter the Turkey, they will have all the information about international patient on their system till they leave. And obviously after the pre-treatment, if any issue happen, then the government will take responsibility. They have a health tourism law. They have health tourism department. belong to the ministry, the health ministry. So I think they are taking responsibility to solve these kind of post-operation issues if anyone complain. I think it's better to get treatment from the certificate boards if any clinic has those kind of certificates that also insured by government if they have any problem. In that stage, if you don't mind, I can go back to the Özge and ask quick question because it's related to their dental clinics. Hi, Özge, are you still there?
I'm here.
Yeah, Özge, thank you. It's almost 10 o'clock in Turkey, but thank you very much. So the question, if Aydinlar Dental working with any partner clinic in UK, in your knowledge?
In UK?
Yeah.
And not yet. We are not very familiar with United Kingdom markets. We just held a project with Acıbadem Health Group and Aydinlar Dental to Switzerland. It lasted 7 years. We were going to Zurich and Zug every month, and with a plastic surgeon and an eye doctor. And we were seeing face-to-face our patients and making consultations and planning, and they were coming for plastic surgery and dental treatments. We were working with the agency there, and we have a partner clinic there in case an urgent situation. I want to emphasize the success of the team in this international treatments. We had almost no failure just for this long period. One of a porcelain crown fell down in Switzerland. It was an implant crown. It was not a break, but he was not able to come to Turkey. What the clinic glued the crown, and we paid for it. The treatments are under guarantee. And now we are very, new to UK market, and I'm glad to hear the speakers, they gave very valuable information about, what we need to prepare, what is necessary to be successful to attract the English patients' attention. But we are going to open I think, correspondence office and make a collaboration with a dental clinic, and we will guarantee all the, things in case an urgent situation or something happens. But for Switzerland patients, we had no failure. And if the plastic surgeon was Şükrü, maybe Dr. Erel knows. He was doing, breast augmentation and rhinoplasty most of the time for Swiss patients. He was controlling, checking his patients each time we went to Switzerland, if anything, because they stay like 1 week in Istanbul and return their country. We were following up them very well. And we want to make, again, a new settlement in United Kingdom with Aydinlar Dental. And we want to search a clinic or a partner clinic there. And we get the certificates in the name of Aydinlar Dental, because Acıbadem has the certificates, but Aydinlar Dental is now trying to make this by its own single company. So we are working on it.
That's great. One of the our sponsors, actually, event sponsor, own clinic, dental clinic based in London, Harley Street. They are really good, top qualified services. So I strongly suggest own clinic. Yeah,
own clinic. I wrote down it. Thank you for your tip.
Yes, they are fully qualified serving in UK. So Ertan, as she mentioned that they are going to Zurich to see the patient there, but I don't think that any Turkish doctor can easily come to UK and see the patient just by the rule. They are not allowed because they have to have a certificate diplomas allow them to work in UK. Am I right, or am I just?
Any doctor who wants to examine a patient, they need to be registered with the General Medical Council. So there were a few, I think, complaints in the past that doctors came from Turkey and examined their patients, and the patients complained, and the clinics had some letters from the General Medical Council. It is possible to talk to the patients, but not to touch and examine them. So that's the regulation in UK.
Yeah, maybe if they work with the partner clinics, they can be on the side at the same time, but the UK certified doctor can examine the patient alongside that Turkish doctor can speak or advise anything, maybe, I'm not sure. But it could be like bridge between UK to Turkey, and collaboration is good. So on that stage, the UK business advisor, Kemal Sidar, can help out with the London Bridge project. They are the great company serving international companies to promote their services in UK, and they are the #1 sellers in Amazon for their their client companies' products. Kemal, if you talk about how you provide the services for your international client in UK, can you also serve for the clinics in Turkey?
As a clinic owner in Turkey, and also helping international clients to relocate in the UK, we always start with the initial analysis to understand the requirements. As I previously mentioned, that it's very important to understand if the service or the product is fitting the expectations of the, let's say, UK customer or patient expectations. We initially make an analysis to understand our client. It's what's fully satisfying, as Ertan has mentioned, comprehensively, of the UK expectations. Because if we speak about more about healthcare industry, Turkish healthcare industry, most of the time they are looking for, let's forgive me, easy money. So just sell it and do the operation and forget the rest, which is not valid for international expectations. We try to explain our clients that you need to cover all patient life cycles, starting from their friends, their family, giving some packaging, preparing some packaging, some bundles, having all pre-op operations planning together here with your touchdown in the UK, creating a experience, not only the operation, also touristic sites, or having a family member with them, sightseeing. Sometimes, actually most of the time, they want to see Istanbul or travel to Izmir or see Bodrum, Antalya, wherever they want to go. And whenever they come back, doing the regular follow-ups, again, managed by the UK team. When you create that setup, after having your correct analysis to understand the expectations, when you create that setup, also providing a decent digital marketing campaign, there is no way that you're going to be unsuccessful. And I know a lot of doctors and clinics and some hospitals doing great by providing that comprehensive patient experience. So whatever we are selling, as we are selling cosmetics, ceramics, textile, furniture, as well as the healthcare, because we have different operations and divisions in our team, we always look for if our client is fully understanding the UK market expectations, because there is no easy money in the UK. It's very competitive. People are forgiveness because they speak about services very much to their friends, and it's not easy to have their money. And most of the time, the money is not the main priority for them, because they have that budget in the UK. They are concerning about the quality of the service. if we speak about a certain level of the people, because there are several kind of patients. I mean, there are some, for example, price sensitive patients I faced a couple of times. They are speaking about, I mean, they care about the 50 pounds or 100 pounds. But this is not the profitable side of the business. The profitable side of the business are having their operations in the UK or going to Spain or Italy or US most of the time. So we need to reach that market and gain that patient and have them in Turkey.
Yes, that's correct. Ertan, Erel, do you have any additional comment, anything on this stage?
Yes, I can briefly tell you about what's happening with the marketing. Traditionally, plastic surgeons are located in their local hospital, and the surgeons work in the NHS, and then they work locally. So the patients are sort of, or the clients comes into the private hospital, asks which doctor shall I see, and then they recommend one or the other one, whoever is free. But this has changed dramatically in the last sort of year or so. There is a Google advertisement. So patients start searching online, plastic surgeon, or the procedure's name, rhinoplasty or breast augmentation. And Google makes money from this. So each time somebody clicks, it is either £1 or £2. I did advertise in the past, they charged me £2 for each click. So the patient can go onto my website and check on me. And if she's happy, she can book with my recommended clinic. Now this price has gone up to £7 for each click around Manchester. So it's a lot of companies, and also a small group of people who served in the healthcare. They have their own companies. So everybody's advertising it and asking them to fill a form in, and then getting back to them. So like the London company I'm working, they have about 10 people in the background just answering all these forms. And then they get back to them within a day, and then they arrange the patient to be seen within a week or so usually, or 2 weeks. And then as soon as the clinic takes place, the next day they call them and give them a price, and they try to sell the procedure. So it's a lot of competition going on, and then the price competition with different companies as well. So I work with different companies, so sometimes I get the same patient asking London company and Glasgow company, so they're all searching online, and then the follow-up every day after the operation, they get a phone call from the organizer or whoever is looking after that patient. So they have very good aftercare, and they ask them for a feedback. So there is another company I know, he's got more than 100 feedbacks from the patient group. So they're all after feedbacks, images online. So everything has changed. So if you can't adopt that, it becomes more difficult to compete in the market. And if your reviews are not good, or you haven't got much reviews, and you want to get into the market, so you might be wasting your time or wasting your patience.
So I think transparency is very important. Maybe Kemal knows better than me that Trustpilot is the company giving the reviews for any company serving UK. Also TripAdvisor for the restaurants and the holiday companies. But I'm not quite sure, I'm not aware if any health tourism clinics, services, agencies has this kind of circles that a patient can easily get review information from this kind of affiliate platforms. But on the Google, I am the digital marketing expert in UK. So on Google, you can pay much and you can gather more views. It's easy, but when you talk about the health, it's more important things that you have to be double careful. So I think any health care companies in Turkey, they have to serve transparency information on their website, and they have to give a lot of feedback, their own client feedbacks to the certain platforms that anyone can reach and get the point. So Özge, how you deal with your international patient reviews in your brands, in your clinics?
Actually, in Acıbadem, after their treatment finishes, our secretary gives an enquete form to fill in, and they keep them in database. But I think we are not very good at advertising them. But now we know our missing points, that we need to pay attention for more advertising. We have very qualified things to show, but for advertisements, maybe the name of the hospital is too, qualified, is very well known. We have actually health spots for Acıbadem I think in many countries, but I think they are not publishing the feedbacks. We need to show them off. I think we need to show them more to give more information to the other patients looking for dental treatments abroad. But now with Acıbadem Aydinlar Dental, we started to give more advertisements, and we are working on this. Our boss had a great team for digital marketing, and they are working very hard, and they are collecting data and investing many things to be successful for abroad, because after COVID, hopefully finishes, we want to show our potential, because we trust our team, we trust our work and equipment. Doctors are all expertise, and we want to sell our success, and we want to reach more people abroad, because there are many clinics in Turkey. They are making health tourism, but even the clinics are not very good, in not very good regions. But I cannot understand how they are successful, how they made this connection. And maybe it's our missing point, that we didn't give too much advertisements on our work. Now we are working very hard in the social media and in the websites.
PR agencies work very well in UK. If any organization involve their services, so you can contact maybe UK PR agencies, UK digital marketing agencies, to provide you as a brand your services in UK market. Because when you give an advertising in Google, you have to make it specify the location. So if you don't reach the UK, you are not visible. So the people can see your advertising only in certain country which you selected. So to be visible in UK, I think better to communicate with the local agencies here.
Sorry to interrupt. We are about to make some agreements with companies in UK, but they are not announced yet. Even I don't know, but our marketing department is working on it. I think they had already an agreement with a partner clinic to work, maybe to go for them and to make consultation, even maybe bring patients who wants to come to Turkey. That will be, I think, encouraging UK patients to come to Istanbul or Turkey or to our clinic. And I think in a very short period of time, they will announce, our boss and his marketing team will announce it to us.
Great.
Mhm.
I've been living in UK almost 15 years now, and I am always belong to the health tourism sector. So as I was one of the advisor in UK, they can contact me. I can advise which agency is the best. They can collaborate with me as well. Also, Kemal, Sidar can help. He's the one of the best person in UK to help to give the business advisor.
So kind
And
of, thank you.
also Ertan, Erel, best practice experience plastic surgeon in UK, serving many years, so he can also give an advice. Thank you so much. I'm going to ask attendees if anyone have any question. I haven't seen any question in the Q&A box. Oh, I see that. Selim Jonathan, I would like to ask two questions to Mr. Sidar and Dr. Erel. One, is any health insurance company in UK cover specific costs for specific treatments in abroad, except beauty treatments, dental, hair transplant, cosmetic surgery, etc.? I think he covered this question earlier. Do you want to add anything on that?
I would say yes, that some companies cover it. And there is a world tourism market. Every year they do like a conference in London. So there were some speakers about, and also health tourism journal. So it's possible to do a search and find out which one covers what.
And the second question, we talk about incentives in Turkey, but in the other side, after the overwhelming cost of NHS after pandemic, will the NHS or UK government promote treatments in abroad? What do you think about this? I think this question to...
Okay, I can answer this question. NHS, because they sort of have contract with the European Union countries, and they used to send patients for hip replacement, knee replacement to Spain, Italy, and a group of professionals, they wanted to arrange an agreement between UK and Turkey, but we were not in the EEC fully. So that has not gone through as far as I know. But now UK left EEC, so UK will have more sort of options to decide on their own. So I'm sure there will be some health discussions that are going on from the government level or health tourism level with the UK government. But I would say it is possible to do it. But insurance companies need to accept it for some treatments, and the rest NHS might be able to buy some treatments in Turkey for their patients.
May I add something as well?
Yes, sure.
The UK is basically Turkey's second largest export area. So it's a very important market for Turkey, and Turkey is also important for the UK if you speak everything, including all the products and services. This can be possible, as Ertan Bey said, which is not very closely, but Turkish government has a deep responsibility to make it happen. Because lobbying and also relations takes a lot of time in the UK. Arzon, you are familiar with the UK daily life. You know, it takes a lot of time to get in socialization as well. So if the Turkish government, Ministry of Health, and the hospitals in Turkey come together and make that lobbying in the UK, eventually it will happen, because we have one of the top healthcare industry in the world. I'm honestly believing it after having all the clients, all the patients and the doctors. We do business together. However, we are really weak on doing any kind of lobbying or direct influence on the UK government. As Ertan Bey said, we need to influence the insurance companies because they are the main drivers of the healthcare industry most of the time.
That's correct. Okay, another question. If you don't want to write down, you can maybe ask me to unmute your microphone, then I can allow you to speak. There's another question, I think in Meral. Can we get Turkish government incentives, benefits if we start our business in Europe or in the UK? Or do we need to have a Turkey-based company? I think he's talking about the health sector kind of business.
I can answer if you don't mind. Okay.
Yeah.
Yes and no. Yes, you can use the incentives when you register an international company anywhere in the world. The mandatory of this condition is you need to have at least 51% of the company. So it has to be Turkish capitalized company in international site. Otherwise, you cannot use. For example, if you're a Turkish businessman having a company in Turkey, creating a subsidiary in the UK, yes, you can apply. Or if you directly register a company on your name, having more than 51% of the share, yes, you can apply for the incentives, but it's like holding your ear on that site. So the easiest way to apply directly from the Turkey, because the nature of the incentives, Turkish governmental incentive, is supporting the Turkish brands on international markets. And most of the time, they also expect you to have the brand. So I suggest them to apply direct from Turkey, or at least having at least 51% of the international company by Turkish capital.
That's great. Any more questions? There's no Q&A box. I ended the polling. You can see the result, and I'm wondering who said. I asked, are you satisfied to have a health service in Turkey? And someone said no. One person said no. So if you are still here, I'm wondering what was the reason? What was your story that you are not satisfied? If you don't mind to share with us. Okay, secret. And I asked which country is your home country. Most people say UK and Turkey and the other country. That's all. Okay, thank you very much. If you would like to add anything, the time is showing 8:30, so it's almost been 1.5 hours. We spent time. It was a great presentation and talks. Thank you very much. All your suggestions and the talks and also collaboration about this topic. So yeah, thank you very much. Hope to see you again sometimes about the related topics. So I need a dental treatment. So Özge, probably I'm going to visit you when I come to Turkey.
I'm waiting for you. When you plan to come, are you under restrictions or can you easily get?
We cannot travel unless we have emergency reason at the moment.
There is no direct flight as well.
Yeah, there are transfer flights. But yeah, I think I'm going to be responsible and stay safe here, as my government suggested not to go anywhere.
But can I ask you something? I have a patient from Manchester. We treated him a few years ago, and he wants to come to Istanbul desperately with his friends because he gave reference to his friends for Istanbul and our clinic. And a few days ago, he WhatsApped me asking for an invitation letter that they need a dental treatment. Is it working? You know, he really asked me an invitation letter to send him because, you know, otherwise they cannot leave the country.
No.
As I said, it needs to be emergency reason. If his case is very emergency, if he cannot treat it here, maybe they can accept occasionally, but I'm not quite sure. It's up to you. It's your responsibility.
I will send something from hospital. He will try, I think.
Yeah.
The current regulation is if you go to Turkey, when you come back, you need to stay at home for 10 days. So you can't go to work because of Turkey's infection rates, etc. But this will be reviewed later in May. So if the immunization increases in Turkey, then this may change. Some countries, they are on the red list, and if people goes to there or they come from that country, when they enter UK, they need to stay in the hotel for 10 days and pay all the costs for the government hotels, designated hotels. So this is the restriction at the moment, but this can change. That will be on the government website.
But most of the countries like, Switzerland and Germany, so I think 24 hours before the flight, they have a PCR test, and with this test, they can go to their country unless they show that they are negative. They can easily, but I think it's more strict in UK.
Yeah, people can go, but then coming back is the problem. Either has to stay in the hotel or at home. So before you leave, you have to have test within 3 days, COVID test within 3 days. Otherwise, you can't fly. Now we're talking about the passport, because I had 2 vaccinations. So I got the vaccination card, but the government is talking about if people are vaccinated, they can go and come back. So that's the next stage.
Yeah.
I think for this particular patient, Özge, you can ask if they already had their first vaccine. And also they are happy to isolate when they come back, So Temin Nat say thank you for valuable info. Can you please share the contacts? So easy, if you just type it your website link, something that they can reach you. Or I can share all of their information again when I send you the thank you email after the webinar.
Might be easier.
I'm going to share this webinar video on YouTube channel. Sectoral Events has a channel, so please subscribe us to get notified for the upcoming webinars as well. Any more things? Yes. Okay. That's great. I hope you enjoyed, Özge. Thank you very much. It's very late at the moment in Turkey, but I hope it's a valuable webinar for your company and yourself as well.
Definitely.
Kemal.
I enjoyed a lot. Thank you for everyone for giving very valuable information. Definitely, we will get in contact with you.
Thank you. And Kemal, Sidar, thank you so much for your information as well. We will get in touch for related for the related similar project as well. Ertan, Erel, we've been getting in touch almost 10 years, so I'm sure any next stage that if I need your help, you will be here. Thank you so much. I really appreciate, as always, you support my works, and obviously, I try my best to help you as well.
Thank you, Arzu. You're always welcome.
Thank you so much. So have a great evening, everyone. See you next time. Stay healthy and stay safe wherever you are based in the world. Thank you. Have a good evening.
Bye.